Hello, I'm Dr. Ryan Westbrook, and I want to talk with you about something that most people completely ignore until it's too late. Your feet. Specifically, what happens to your feet after age 60, and why the changes you're seeing down there might actually be warning signs of much bigger health problems happening inside your body. I've been practicing medicine for over 20 years, and I've noticed something fascinating about my patients over 60. When they finally come to see me with a health concern, I always look at their feet first. Why? Because your feet are like a window into your systemic health. They tell stories, and after 60, those stories become really important to pay attention to. The truth is, we tend to ignore our feet until they hurt. And by that time, we've often missed the early warning signs that something more serious is developing. Today, I want to change that for you. I'm going to show you exactly what changes to look for, what they might mean, and most importantly, what you can actually do about it. Let me start with something you've probably noticed. Do your feet look different than they did 5 or 10 years ago? Maybe they're puffier. Maybe the skin texture has changed. Maybe you're noticing discoloration or veins that seem more prominent. These aren't just cosmetic changes, these are signals from your body. One of the most common changes I see in patients over 60 is swelling in the feet and ankles. Now, a little swelling at the end of the day, that's pretty normal, especially if you've been standing or walking around. But if you're noticing that your feet are puffy when you first wake up in the morning, or if the swelling doesn't go down after you've been resting with your feet elevated, that's a red flag worth paying attention to. This kind of persistent swelling can indicate several different things. Sometimes it's related to your circulation. As we age, our cardiovascular system changes. The veins and arteries that carry blood and fluid throughout our body become less efficient. When that happens, fluid starts to pool in your lower extremities, particularly in your feet and ankles. That's where gravity wins. The fluid has a harder time getting back up to your heart. But here's what's important. This swelling can also be a sign of kidney issues, liver issues, or heart problems. I've had patients come in with swollen feet, and when we ran tests, we discovered they were in the early stages of heart failure. The body was retaining fluid because the heart wasn't pumping efficiently enough. Now, I'm not saying every swollen foot is a sign of heart disease, but I am saying that persistent swelling deserves attention. Let me talk about the skin on your feet. After 60, you might notice that the skin becomes thinner, drier, and more fragile. You might see cracks developing, especially on your heels. Some people develop this condition where the skin literally peels and flakes. Now, most people assume this is just dry skin, so they put some lotion on it and move on. But what they're actually seeing might be a sign of thyroid problems, diabetes, or even nutritional deficiencies. I want to tell you about something else I see frequently: changes in the color and texture of your toenails. This is important because toenails are incredibly informative. If your nails are becoming thick and brittle, that's one thing. But if you're noticing discoloration, maybe they're getting yellow or brown or developing streaks, or if the shape is changing, that can indicate fungal infections, which are common in older adults. But more importantly, nail discoloration can also be a sign of lung issues, liver problems, or kidney disease. I had a patient come in last year, a woman who was 64. She mentioned almost casually that her toenails had been looking weird. They were getting thick and kind of yellowish. She assumed it was just a fungal thing. But when I looked at her feet more carefully and did some additional testing, we discovered she had early-stage lung disease. The nail changes were actually a sign of that. Then there's the issue of numbness and tingling in the feet. This is something I want you to take very seriously. If you're experiencing pins and needles sensations, or if your feet feel numb or like they're falling asleep and not waking up, this could indicate peripheral neuropathy. This usually means there's nerve damage, and nerve damage at this stage of life most commonly points to diabetes or pre-diabetes. Now, you might not have been diagnosed with diabetes, but here's what happens. Type 2 diabetes often develops slowly, over years, and some people don't get diagnosed until there's already significant damage. Nerve damage in the feet is actually one of the early signs that your blood sugar levels have been too high for too long. The good news? If we catch this early, before there's permanent damage, we can actually reverse the progression. I also want to talk about pain. Not the normal ache you get from walking around all day, but chronic foot pain that's there even when you're resting. Some of my patients describe this as a burning sensation. Others say it feels like their feet are on fire. This could be from neuropathy that I just mentioned, but it can also indicate poor circulation, arthritis, or inflammatory conditions that are systemic, meaning they're affecting your whole body, not just your feet. Let me talk about something that really concerns me: changes in how you walk. If you're noticing that you're walking differently, maybe favoring one foot or developing a limp, or if you're becoming less steady on your feet, these aren't just aging changes. These could be signs that something is affecting your balance, your strength, or your proprioception. This could point to neurological issues, inner ear problems, vitamin B12 deficiency, or even early Parkinson's disease. I want to be clear. I'm not trying to scare you. I'm trying to empower you to pay attention to what your body is telling you. Most of these conditions, when caught early, are very manageable. But when they're ignored, they progress, and they get harder to manage. Let me talk about the structural changes in your feet. After 60, many people notice their feet are getting wider or flatter. The arches are collapsing. This happens because over decades of walking, the ligaments and tendons in your feet lose elasticity. The supportive tissue just isn't as strong as it used to be. This is normal aging, absolutely. But when your foot structure changes, it affects your whole body. Here's why. Your feet are the foundation for everything. When the arches collapse or the feet get flatter, your gait changes. Your knees have to work differently. Your hips compensate. Your spine has to adjust. What started as a foot problem becomes a whole body postural problem. And that can lead to knee pain, hip pain, lower back pain, and eventually problems even further up your body. I've had patients where we could solve their chronic lower back pain just by addressing the structural issues in their feet. Getting proper arch support, sometimes custom orthotics, really made a difference. Now let me tell you about ulcers, or sores on your feet that don't seem to heal quickly. If you have a cut, a blister, or a sore on your foot and it's taking weeks or months to heal, that's abnormal. That indicates poor circulation or impaired healing, often related to diabetes. This is something you need to get checked out because non-healing wounds on the feet can become very serious very quickly if they get infected. I also want to address something that many of my older patients feel embarrassed about: fungal infections of the toenails and feet. They feel like it's a cleanliness issue, but it's really not. Fungal infections become more common as we age because our immune system changes, and the microbiome on our skin changes. But here's the thing: fungal infections are not just a cosmetic issue. If they spread, if they get into the skin and cause cracks, you've created an entry point for bacterial infections. And that can become serious. Let me talk about your feet and your balance. This is huge as we age. If you're noticing that you're becoming less steady, if stairs are becoming more difficult, if you're worried about falling, a lot of that might be related to changes in your feet and ankles. Your feet have sensory receptors that tell your brain where your body is in space. This is called proprioception. When sensation in your feet decreases, which can happen with neuropathy, circulatory problems, or just normal aging, your balance gets worse. And falls are the leading cause of injury-related deaths in people over 65. So anything affecting your balance and foot health is actually affecting your safety and your independence. Here's what I want you to understand about what's happening in your body after 60. Every system is changing. Your cardiovascular system is less efficient. Your metabolic rate is slower. Your kidneys are filtering blood less effectively. Your immune system is weaker. Your nervous system is changing. Your skin is thinner. And all of these changes show up first, often in your feet. Why? Because your feet are far away from your heart. They're the last place to get good blood circulation. They're the first place where swelling shows up. They're where numbness from nerve damage becomes noticeable. They're where poor wound healing becomes obvious. Your feet are literally at the end of the line for all of these physiological systems. So what should you actually be doing? First, you need to be looking at your feet regularly. I'm serious. Once a week, sit down, take off your socks, and really look at your feet. Look at the color of the skin. Look at the nails. Feel for swelling. Look for any cuts or sores. Check for changes in how they look compared to last week or last month. If you have diabetes, or if you're at risk for diabetes, this becomes even more important. You should be checking your feet daily. Diabetes damages nerves, so you might not feel a small cut or blister, but that small cut can become a big problem fast. Second, you need to see a podiatrist or your primary care doctor if you notice any of these changes: persistent swelling, significant discoloration, thick or discolored nails, numbness or tingling, chronic pain, changes in how you walk, or any sores that aren't healing. Don't wait. Don't assume it's normal aging. Get it checked out. Third, you need to keep your feet clean and dry. Keep your toenails trimmed straight across, not in a curve. Don't try to cut away ingrown toenails yourself. Let a professional do that. Wear socks that fit well and aren't too tight. Wear shoes that give you good support and don't rub or create pressure points. Fourth, pay attention to your circulation. Keep moving. Walk regularly. This keeps the blood flowing to your extremities. If you're spending all day sitting, your circulation gets worse and fluid pools in your feet. Movement is medicine for your feet. Fifth, keep your weight in a healthy range. Extra weight puts stress on your feet and also increases your risk for conditions like diabetes and heart disease that show up in your feet. Sixth, if you have any of the warning signs I mentioned, particularly numbness or tingling, get your blood sugar checked. Get your thyroid checked. Let your doctor know about the changes you're seeing. Seventh, manage any chronic conditions you have. If you have heart disease, if you have diabetes, if you have kidney problems, managing those conditions directly affects your feet. Good management of these conditions will slow the changes in your feet. Eighth, consider getting custom orthotics if you're having foot pain or structural issues. This can make a huge difference in how you feel and how well you can function. Now, I also want to talk about something that often gets overlooked, the psychological impact of foot problems in older adults. When your feet hurt, when you're worried about falling, when your feet are swollen and uncomfortable, you move less. You become less active. You get depressed. You isolate. And all of that accelerates aging throughout your body. So taking care of your feet isn't just about foot health. It's about your whole quality of life. Let me give you a real example. I had a patient, Richard, who was 63. He came in because his feet were swollen and painful, and he thought he just had to accept it. He was limping around, had cut back on his activities, wasn't walking anymore. We discovered he had early-stage heart failure, which was causing the swelling. We got him on the right treatment for his heart. We gave him compression stockings for his feet. Within a few months, his swelling was down. He was walking again. He was active. The foot problem actually led us to discover a serious heart condition that we could treat. Or take Margaret, who came in because her toenails were looking weird. She was embarrassed about it, almost didn't mention it. But when we looked at her feet and did some blood work, we found out she was pre-diabetic. We caught it early. She changed her diet, started exercising, lost some weight. When we rechecked her labs 6 months later, she was back in a normal range. She prevented herself from developing diabetes. That's the power of paying attention to your feet. So here's my message to you. Don't ignore your feet. They're not just carrying you around. They're communicating information about your health. After 60, they're literally telling you stories about what's happening in your cardiovascular system, your nervous system, your metabolic system. Learn to read those stories. Every single day, I have patients tell me they wished they'd paid attention earlier. They say, if only I'd noticed this change and gotten it checked out. So I'm telling you right now, notice the changes. Get them checked out. Don't assume they're just normal aging. Don't assume they're just cosmetic. They might be, but they also might be your body's way of warning you about something important. Your feet deserve attention. Your health depends on it. Take care of them. Pay attention to them, and talk to your doctor about any changes. That's how you stay healthy and independent as you age. Thank you for watching. If you found this helpful, please hit the subscribe button. Let me know in the comments if you've noticed any of these changes in your feet, and if you have questions about your foot health, feel free to ask. And remember, your feet are trying to tell you something. Make sure you're listening.